Folks, we'll start in just about 1 minute. Please hang on as folks are joining us. We'll get started in just a few seconds here. Okay, good morning or afternoon or evening, wherever you may be dialing in from. My name is Suzanne Petroni, and I lead a consultancy called Gender Equality Solutions here in the United States, and I'll be your facilitator for today's inaugural webinar for the Align Community of Practice, which stands for Advancing Learning and Innovation on Gender Norms. Today we're going to introduce you to the Align platform and its features, and we'll also provide an overview of gender norms, including how they're being tackled around the world. We'll talk a little bit about how gender norm change is being measured and evaluated, and hear about some great examples out there. Our speakers, who are renowned experts in the area of gender and development, will touch on both the theoretical and practical, and give us some examples of innovative and effective approaches to gender norm change in the Global South. I want to note that today's session is being recorded and will be available on the Align platform that you'll hear about shortly. We have 3 speakers today, as you see on the screen, and I'll introduce them now so we can move hopefully seamlessly through the presentations. And just to tell you what the format is, the presentations will take about 35 to 40 minutes in total, which will leave us about 20 minutes for questions and answers. And at the very end of the call, we'll ask the participants to join us in a very brief polling exercise, which is intended to help the Align project team determine how best to meet the needs of the global community that's interested in learning about and collaborating on gender norms. So please stick around for that. If you have questions during the presentations, please type them in the chat box, which should be to the right of your screen. You'll see a line that says chat. Just click on that arrow and type in your question, and I'll collate those and ask them on your behalf during the discussion period. And just to note, everyone will be muted on this call except for the speakers so that we can reduce the background noise that sometimes comes with these types of calls. So let me go ahead and get started now and introduce our speakers, and I'll ask them to as I introduce each of them, turn their webcams on so you can just get a brief view of who they are, and then just to keep our bandwidth issues, you'll see them go off screen and see the presentations. So first, we'll hear from Dr. Caroline Harper, who directs the Align project on behalf of the Overseas Development Institute, or ODI. And Caroline, if you can turn your screen on. Caroline has a PhD in social anthropology and is currently the Principal Research Fellow and Program Head of Gender Equality and Social Inclusion at ODI. In addition to leading Align, she serves as Senior Strategic Advisor for the 9-year Gender and Adolescence Global Evidence, or GAGE, longitudinal study funded by DFID. She's previously led diverse programs for the Chronic Poverty Research Center, Young Lives, Save the Children, and other organizations. And these programs include gender equality, childhood, adolescence, chronic poverty, and exclusion and empowerment. And she's undertaken work for multiple multilateral and bilateral agencies and NGOs. Thanks, Caroline. Just to note, Caroline's presentation will be a little bit longer than the others, as she'll first give us a broad overview of gender norms and global development, and then introduce the Align platform. She'll be followed by Lori Michaud, who is the co-founder and co-director of Raising Voices. And Lori, if you could, there we go, thank you. Raising Voices is a feminist nonprofit organization based in Kampala, Uganda, working to prevent violence against women and children. Lori spearheaded the creation of the GBV Prevention Network, which has more than 1,000 members in the Horn, East and Southern Africa. She's got extensive experience in community mobilization, has written numerous articles on violence prevention, and leads a team dedicated to infusing global violence against women prevention work with the transformational potential of solidarity, activism, and technical rigor. Lori received her master's in human rights from Makerere University in Uganda, and after 20 years of being based full-time in East Africa, she now splits her time between Boston and Kampala. And lastly, we'll hear from Dr. Ravi Verma. Ravi is Regional Director for the International Center for Research on Women, or ICRW's Asia Regional Office, based in New Delhi, India. Over the past 3 decades, Ravi has worked on issues of men, masculinities, male sexual health, and gender equality as they relate to violence against women, and reproductive health, including family planning and HIV/AIDS in India and across Asia. He's published extensively on these issues in both Indian and international journals. And Ravi also serves on numerous advisory committees for the government of India, including those related to HIV and AIDS, child marriage, gender-based violence, and adolescent health. And with that, I will turn it over to Caroline to get us started. Caroline.
Well, hello everyone, and good morning, afternoon, good evening. We're delighted to host this webinar and to talk to you about gender norms. My presentation will review why gender norms have risen up the agenda in so many countries, how norms operate, how we define norms, what sectors and issues they affect, and a review of what we know about change. And then, as you've heard, my colleagues on the webinar will be talking to some more specific change examples of their work in different country contexts. So there has been a realization growing over recent years that behaviors and attitudes informed by cultures and social practices are not fixed and permanent, that cultures can and do change, and that discriminatory and harmful practices are not too complex or not our business, in the sense that if we support human rights for all people, then abuse of those rights is everyone's business. So we ask, why has this happened? Why are norms increasingly part of the development discourse? Well, there has been a realization that addressing the economy or services alone will not lift all people from ill health or poverty or the effects of discrimination. A realization that we can invest in changing the supply side, deliver more services, build better infrastructure, grow the economy. But if we do not address the significant barriers on the demand side, including gender norms, then we will not shift the uptake of services or engagement in economies. A realization that people's well-being contributes to all elements of successful societies, and of course an increase in attention to human rights and interlinked capabilities. Amartya Sen captured this helpfully when he stated that comparative indifference to the importance of the social needs remedying, and having a Nobel Prize winning economist recognize human capabilities was hugely helpful to focus attention on how people achieved capabilities. And this was about 15 to 20 years ago. New momentum towards gender norm change has thus been realized, especially in the last 6 years, with increasing usage of the term norms, an enhanced focus on programs that can change norms, laws and policies to enhance empowerment, and a focus on the power of social movements, and importantly, communications and new technology to bring about social change. So how do norms operate to hold societal progress back? This is not simple territory. And once one enters the world of norms and norm change, it is clear that there are different types of norms held in place by different drivers and beliefs and different levers of change. Of course, this is not news to any of us. We all know there are different norms. We practice different norms in our own worlds every day. It may be customary to queue or not queue, to apologize before we speak, to bow and signify deference to certain people, to defer to elders or not, our marriage customs, our work customs, our health customs. This complexity is not insurmountable. We already in multiple ways seek to change norms and have done so over the years. Our approaches include focusing on individuals and groups, on wider society and institutions, on power relations, and on the state. In the slide that you're looking at now, we've sought to explain how each approach has some key insights and also accords with some key theory and disciplinary tradition. A key point to notice here is that some practices can be changed by a focus on individual behaviours. For example, some health practices such as smoking or safe sex or paying taxes. Social psychology and behavioural theory have paid attention to these. Other practices are based on beliefs which embed power relations into the practice and require action at wider societal levels, as individuals alone cannot change their circumstances when others hold power over them. This includes, for example, early marriage, FGM, unequal pay, inheritance rights for women, domestic violence and punishment. So you will see that there are some key insights which draw from different theory and disciplinary tradition. This includes social psychology, game theory, behavioral economics, anthropology, feminist power analysis, political analysis, amongst others. You will notice that we talk about both social norms and gender norms. We see social norms as the implicit, informal rules that most people accept and abide by. Social norms are influenced by belief systems, economic context, by perceived rewards and sanctions, meaning that your behaviours are rewarded if you conform or punished if you diverge. Norms are embedded in formal and informal institutions and produced and reproduced through social interaction. They change when sufficient numbers of people choose to act or are compelled to act in a different way, thus creating a new norm. Gender norms are a subset of social norms that express how people of a particular gender and often age are expected to behave in a given social context. Gender norms often reflect and reinforce unequal gender relations, usually to the disadvantage of women and girls and of men and boys who do not conform to the prevailing gender norms. Gender norms are generally understood in a binary way, considering male and female without allowing for non-binary gender identities. Gender norms are more likely to include some complex relations of power. They operate in some implicit ways. They are invisible and widely accepted. They're embedded in our institutions. They're sustained through everyday social interactions and can be taken for granted unless challenged. So what kind of issues do norms affect? In fact, they're embedded across many areas: educational participation, physical and mental health, job segregation, control of economic assets, and issues such as gender-based violence and others that we've listed here. So they affect a wide range of sectors and issues. And the detrimental outcome for women and girls in particular can be seen to be derived from embedded beliefs and practices and the norms, rules by which people abide. So you can see in this slide that the beliefs result in issues to do with sexual and reproductive health, to do with economic empowerment, to do with violence or lack of political voice. In summary, norms empower some groups of people with material, resources, authority and entitlements while marginalizing and subordinating others by normalizing shame, inequality, indifference or invisibility. And it's important to note that these norms reflect and reproduce underlying gendered relations of power, and that is fundamentally what makes them difficult to alter or transform. So how do we learn about the most effective change actions? Well, different approaches take account of the issue at hand, power relations, if there are any, and local context. For example, as you can see in this slide, there are different approaches which, for example, promote new knowledge. For example, new knowledge about the health impacts of child marriage, which has helped to shift towards later marriage amongst minorities in Vietnam. You can reframe the issue and bring it to national attention. The disability movement has been quite successful to show disability as a rights issue, not a medical problem, reframing it. And social movements for women's rights have obviously been absolutely key to change in women's empowerment. You can change perceptions of what others approve or disapprove of. For example, there have been public cooking competitions for boys organised by CARE in Bangladesh, challenging the norm that cooking is not men's work. You can show that a new normal belief is common, and radio and TV dramas, public commitment ceremonies have all done this, for example, Tostan in West Africa. And you can associate new norms with positive role models, again through radio and TV dramas amongst other medium, such as with Breakthrough in India. It is often also necessary, however, to make structural and institutional changes. It's really important to mandate new practices in law, to change institutional policies, to promote new economic opportunities, and to increase infrastructure and service provision. So what theory of change, understanding what changes norms, does require different theories of change for different contexts and issues. And many people work with different theories of change appropriate to the situation that they're working in. But most norm change will require institutions to adapt and will have a set of individual factors, a set of change transmission mechanisms, and a wider socioeconomic context that's also in play. It's important to note that change happens all the time and not always in positive direction. Norms can harden and become more discriminatory. Often it may be 2 steps forward and 1 back in efforts to realize capabilities. There are many challenges, and I'm sure many people on this webinar have examples of the challenges they have faced when working in this area. We need to tackle multiple norms at once. For example, education and labour market access are linked. You can provide secondary education for girls, but you must then provide jobs for women. They also need political voice, and we have to pay attention to safety issues in the workplace. We need to understand that gender is not always the most salient part of identity. Norms are experienced differently and are different for different social groups. For example, being low income or high income, disability versus not disabled. And norm change can take a long time. Sometimes it's very quick. There was a rapid increase in girls' school attendance, but this is relatively rare. Longer project timeframes are needed. And gender norm change is very often political. Power holders rarely want to give up power. People can feel identities and values are under threat, and backlash is a serious risk. You will see that there are some key insights. Oh, sorry. On to the next slide. I'm going to now talk about Align. Align is a knowledge platform on advancing learning and innovation on gender norms. It enables and connects a global community of researchers and thought leaders to challenge and change harmful gender norms affecting adolescents and young adults. And we also look at adults as well, because we pay attention to life course and intergenerational issues. The Align platform, through developing and sharing innovations, aims to advance the understanding and ensure knowledge on norm change contributes to sustainable gender justice. And we have various components through this platform. It's a digital platform, it has curated content, it's a community of practice. We host thematically focused meetings, and we also have funding. This is what the front page at the moment looks like. It also has considerable amount of resources. We're not hosting all resources on the platform because that would be an impossible task, but we carefully select resources that we think will be useful to our community to help people share knowledge and learn about gender norm change. And we also have curated content on the platform. So we ask experts to guide the reader through different learning experiences and guide them to different resources to enable them to learn about how norms have changed in particular sectors and areas. Next slide. So how can you join the Align community of practice? You can sign up for the Align newsletter. You can recommend a resource for our hub, and we encourage people to do that, so you can share with others what your work is doing and they can learn from you. You can recommend a project, an organization or initiative on gender norms to profile for the community page. Provide content such as a recommended reading list, a case study or a blog. engage in our discussion forums and webinars, share news and information. We also have 2 funding windows, which I'll come back to, and convenings. And of course, we welcome your feedback on the platform. We'd appreciate your letting us know what you would find useful, where you would like to see work in this area developing. So the content will include, some of this content is already there, the best of knowledge that we can find in the areas of health, education, women's economic empowerment, and violence against women and girls. And then below this, we have a set of cross-cutting issues which apply to all of the 4 main areas, such as social protection, the use of digital and mass media, men, boys, and masculinities, and the data, tools, and measurement. And we also have a section on theory and concepts and frequently asked questions around theory if you would like to access that and learn more. Next slide. We've hosted 2 funding calls. We have a research fund which supports the synthesis of learning from innovative research. These are small packets of money. At the moment, we have recipients from Peru, Mexico, Indonesia, and Somalia working on analyzing their knowledge, and the outputs can be seen on the platform next year. We have a convening fund, which is just under consideration to support national and regional convenings to communicate knowledge on gender norms and norm change. And next slide, please. It's a global community. The platform has been accessed by users from 133 different countries. And we're really delighted that on this webinar, we've had such a wide range of users from across the world, and we welcome people. We hope most of you have been able to attend. Many of you may have other commitments, but you can come back to this later. But to give you a taste, signing up for this webinar, we had many people, of course, from Europe and the USA, but also from India, Vietnam, Tunisia, Panama, Canada, Chad, Ireland, Bangladesh, Ghana, Senegal, Kazakhstan, Liberia, Colombia, Uganda, Burundi, Turkey, Peru, Ecuador, Myanmar, Zambia, and the Congo, and other countries on top of that. That's not all of them. So we're delighted that we have such a wide range of interests from so many parts of the world in this issue of gender norms and how they change. Finally, I'd like to say that many of us, I know, have been working on these issues for a very long while. It's wonderful to have recognition of how central gender norms and patriarchy are to the development agenda and to establishing prosperous and inclusive societies. And we thank the Gates Foundation for making this work possible. Addressing inequitable gender norms is a proven way of advancing gender justice, and we increasingly have the knowledge and the means to make this difference. And the aim of the Align platform is to share this knowledge and to speed up our learning across the world on how we can make a difference for women and girls and boys and men. Thank you very much.
Great. Thank you so much, Caroline. And thank you to the folks who've joined us. For those who joined us after the introduction, just a note, please type in any comments or questions into the chat box. All of our participants except the presenters are muted for the call. So if you type in the questions as you go, I'll collect them and ask them at the end. So now I'd like to ask Dr. Laurie Michaud to please present.
Thanks, Suzanne. Hi, everybody. Thank you so much for joining from wherever you sit in the world. I'm going to talk a little bit today about some of our work in Kampala around changing gender norms and in our work around preventing violence against women. So next slide. So as in Uganda, as in many, many places across the world, there it's wide acceptability of women's inferiority in Uganda, that violence against women is expected, both within intimate partners as well as just out on the street. It's very difficult for people to discuss sex and sexuality and sexual violence, both publicly and privately within their lives and with others. And there's very negative consequences for women and men who kind of step outside some of the traditional gender roles. So it's a context that's quite common across, our region for sure, and in many others as well. Next slide. So I'm going to talk a little bit about SASA. This is a community mobilization approach that we developed at Raising Voices, and I'm not going to go into detail about it here. There are some resources about it on the Align platform, as well as on the web if you want to learn more about it. But I think the important thing to know is that it is not a curriculum-based methodology, but it's really a community-wide, community mobilization approach that takes several years and really tries step by step to change some of the core drivers of violence against women, namely gender inequality and an imbalance of power. And this is done across the whole spectrum of community members. Both men and women are equally included. It involves community members just at the community level, as well as service providers like the police and healthcare workers, local leaders, a whole range of folks across the ecological model to really build up critical mass to accept some of the new ideas and new norms around equality and shared power. Next slide. So just talking a little bit about impact, there was an RCT done, and that was done with London School of Hygiene and Tropical Medicine, Sedivip, and Makerere University. And SASA was able to achieve evidence of community level impact. And it goes back to, as I was mentioning, it isn't kind of a small group curriculum-based approach, but really one that tries to reach across all levels of a community. So we had changes in attitudes, which you can see, as well as behaviors. And this was really important to us because I think, it's very hard to really understand what it means to change attitudes, right? And it really is important to assess what behaviors we're actually changing. And SASA was able to reduce physical, intimate partner violence against women. Next slide, as well as others. And there's many papers on this, so you can just do a quick Google and it'll be there. So today what I'm going to talk about is not really what worked, but what didn't work, because I think that sometimes that's a little bit more helpful to sort of challenge some of the expected ways in which we do programming, which we certainly did, and we came to realize was not quite right. And so I'm going to just pull one example from SASA around changing the gender norms at the household level. So this is kind of a very accepted and widely practiced approach and strategy for changing dynamics around gender and gender norms, as well as violence prevention, is if we can affect change at the household level within gender roles, then other things sort of have a ripple effect and other things improve. But actually it didn't improve and it didn't really work. And I'm going to talk about three main reasons why. So Ben, if you can advance that one. So the first one is really that just it triggered resistance. So sharing household roles was kind of considered against tradition, and it felt imposed from the outside, whereas SASA is really emerging from the community itself, and both women and men resisted. Women felt, well, will I become sort of valueless? Will he leave? Will I lose my sort of usefulness in the family? And men thought, well, what if my wife will look for someone else to provide? As well as, what will my neighbors think? Will I not be man enough? And it really ignored some of the deeper emotional needs that many women and men perceived as more pressing, like feeling valued and respected. The other issue that emerged from that was really it increased tension between couples. And so it had sort of the opposite effect than what we were hoping, is it actually instigated more adversarial dynamics within the relationship. So it was like a tit for tat mentality. Like, I'll do this if you do that. You didn't do that, so I won't do this. And it really led to many demands, actually, from some men for women to contribute more financially to the household. So it really, rather than bringing couples together and feeling like we're doing something shared, it did the opposite. And the third one is it really limited a deeper analysis of power. So it just felt like it was hijacking conversations, and it prevented a deeper unpacking of power as people became sort of stuck in these tense conversations about like laundry and dishes. And it didn't really necessarily balance power. Women's work was valued less than men's. Men's involvement was still considered sort of helping and an act of benevolence, which could then exonerate other behaviors or justify other expectations. And so it didn't really work for us. Next slide. So this is just a quote from one of the Sedivit staff, and it says, I used to see some men who would come out and boast saying, hey, look at my relationship, it's okay because I help out. And men felt like they were now role modeling really good behavior, much as there were other things like violence that their wives were still quite uncomfortable with. And even then, men's support was quite conditional. So if I wash dishes, she must pay half the school fee. So that's just a little example of how it was playing out in life. Next slide, please. So then what to do? Since this was not an effective entry point, you know, what we, some softening or blurring of normative expectations did occur. But really, this was around how couples were trying to experiment with core relationship values rather than gender roles. And this kind of emerged rather organically, and there was a real motivation and a genuine desire to support one another and strengthen the partnership. And this promoted a feeling of collaboration rather than competition. So one of the Sedivit staff was saying, where people can understand each other, there's respect, love, and joint decision making. And then the gender roles will kind of automatically be addressed, meaning if you have love and respect and feel valued in your relationship, then other things sort of flow from there. Next slide. So we made a lot of changes actually in SASA, and what we did was really start to focus on core relationship values rather than this roles at the household level. And we did a lot of monitoring and observation, and we really realized that if we emphasize values like love and respect and trust and shared decision making and safety, then that really promotes the kind of change that we were looking for and more violence prevention. It really minimized the resistance. It led to people felt more, oh, I can do this and this helps me. They could actually see the benefit of it helping their relationship rather than with the gender roles, which it was kind of just making things miserable. And it really allowed people to talk about bigger discussions around power. So really, what does it mean to respect someone? How do we communicate honestly? How do we actually have a partnership in a marriage or a relationship rather than just be sort of cohabitating together? And it really allowed people to be more aspirational, which is aligned very much within the SASA approach, is really trying to say, how can we make things better than focusing on the negative and what needs to change? So next slide. So was it effective? And we found that it really was, that the evaluation showed that there were relationship dynamics really did improve, and in statistically significant ways, as we found in the trial as well, that couples were more likely to discuss worries, talked about what they liked during sex, which is actually a really hard one to get to. They found that they appreciated their partner's work around the house, so that did evolve sort of naturally, and they engaged a lot more in joint decision making. And this was also played out within the qualitative findings around improved trust, collaboration, and communication between couples. Next slide. So these are just some quotes. Really, you know, she listens to me and I also listen to her. The communication is so good. She can tell me that this is not good, and I also tell her I have not liked this. And then you solve the issue peacefully. And then Sedivit staff is saying, you know, when there is love and respect and joint decision making, the gender roles emerge. Next slide. So what implications is this having? You know, we're really recognizing that for violence prevention programming, that our sort of traditional entry point that we thought, okay, this is the key that sort of unlocks all these other positive behaviors, was really not the key for us within SASA. And so for programmers, you know, we're really encouraging people to, and ourselves, really challenging ourselves to find entry points that connects and inspires and really help reorient programs really toward deeper values around relationships, which is, you know, a little bit softer, a little bit like harder to pinpoint in indicators and results, but slowly, if you're doing longer term programming, which, you know, more effective violence prevention actually is, that it really can lead to better results and more impact. And, you know, really listening and monitoring what's happening when you are doing programming, because we could have just gone through the whole of SASA and not actually sort of stepped back and said, okay, what's happening? So it's really important as we do this very sensitive work with people that we have to monitor direct and indirect consequences and really be willing to listen to people even when it's not quite convenient to us or our own methodologies. And for researchers to really innovate with methods, like let's go beyond. If programming is moving beyond changing gender roles at the household level, how can research methodologies also evolve so that we can experiment with new indicators of relationship dynamics? And I think I'm going to stop there. So next slide. And just to thank, our team here is fabulous at Raising Voices on SEDAVIP, and this really emerged a lot of out of practice-based work. But thank you very much. I'll stop there for now.
Thanks so much, Lori. And now we're going to turn to Dr. Ravi Verma.
Thank you, Suzanne. Thanks to everyone who has joined this webinar. My greetings to all of you, wherever you are. What I intend to do very briefly in next about 7 to 8 minutes is to share with you some of the key learnings from a variety of projects or programs that we have been working for last several years in within the Asia office of the International Center for Research on Women, especially working with adolescents and young men. Next slide, please. So this is a presentation of the experience that I draw from these 4 flagship programs that ICRW and partners have been working with. Essentially what we do in this programs is there are very few programs that have really addressed adolescents and young adolescents. Our first program is Gender Equity Movement in School GEMS, addresses boys and girls in school settings in the age group of 12 to 14 years, very young adolescents, and whereas the program of Parivartan, which means transformation, a change, addresses the adolescent boys and girls not only 12 to 14 but 15 to 18 years of age group. Punk, which means Wings of Aspirations, engages with young men and boys as allies to promote education among girls and delay marriages, and addresses issues of sexual and reproductive health and rights among the boys and girls. And then we have programs Planet Girls, that combines gender norm changing programs with employability programs for girls and engages with adolescent boys and men as agents of change. What these programs, what I'm trying to do is here to give you the overall overview of these different programs and our learning. Uh, all these programs believe in the fact that we must start early, we must use and utilize multiple approaches. We recognize in these programs and question the gender roles, the privileges and entitlements. So what these programs do essentially is to promote a critical thinking aspects of questioning norms, and that's our key approach to dismantling or deconstructing inequitable gender norms. We also recognize and acknowledge in these programs that there are multiple drivers and they intersect with each other. Carolyn Harper mentioned that. And as a result, while we discuss the issues as they pertain to boys and girls, we also bring in other drivers and the context within which some of these beliefs are formulated and practiced. In all these programs, these 2 age groups, 12 to 14 and 15 to 18 years, are critical because these 2 age groups we think are provide very different trajectories of how norms and beliefs are shaped and imbibed and internalized by young boys and girls when they grow up. 12 to 14 is a very early age when they are learning and practicing some of those behaviors and attitudes, whereas 15 to 18 is the age group when they begin to experience the vulnerabilities far more severely, when the girls begin to drop from the schools, when the boys form their own network and begin to segregate themselves away from the girls. And we in a sex segregated societies like India, extremely patriarchal and sex segregated ones, the boys and girls begin to find differences more than the similarities in the manner they think or act, and therefore gender begins to be practiced, and that gets sanctified by practices like child marriages and the division of labor that happens within the households and outside households. And as a result, the institutions become very important in this age group, the schools and the homes and the mediums of sports, for example, that perpetuate certain kinds of division between boys and girls based on beliefs that boys are different and girls are different and they have different capacities, and therefore and those differences are then layered with the value judgment that one can begin to discriminate one over the other. So differential abilities come into play in this age group far more profoundly, and this is why we find these programs very exciting, extremely challenging, and extremely useful for long-term challenges, long-term programs, and impact. Next slide, please. So what have been our learning when it comes to boys, essentially boys and young men? The very first insight that we have drawn from these programs, and I'm not going to throw in the statistics here, but what we see very clearly is that the norms don't change uniformly. There are certain aspects of gender norms that change, but then there are some that don't, and they seem to be far more embedded into the people's realities and boys and girls' own lived realities. For example, the ones that we found on which there is a tendency to uh, agree or to demonstrate a shift are the ones that challenge the subordinate position of women as opposed to the man. So a wife should obey her husband, should always obey her husband is one of the indicators. For example, in our gender norm scale, you see a decline in the number of people who agree to this over the period of programs. Or the fact that violence against girls are perpetrated only by strangers is something that the boys and girls, boys begin to recognize that their violence is normalized and it can happen anywhere, and it's not only strangers who commit violence, it is they themselves who are into relationships commit violence. So people don't see what the boys and young men tend to take these violence for granted. And during the program, they begin to recognize that violence is something that is not to be taken for granted, and they begin to recognize different forms of violence. And in the similar um, spirit, they begin to recognize the private and respectful spaces for girls when they say no or when they say yes, what they mean, uh, rather than imposing their own ideas of what girls want or don't want. But then there are other areas that it seems there is a greater resistance. For example, gender division of labor is something that, despite lot of program reach and discussions, the lived realities is so uh, embedded that they don't seem to completely move away from the notion that women's primary role is that of homemaking and childcare, and man's responsibility is that of providing and supporting or earning and remain external to the households. And similarly, most young boys and young men seem to find it very difficult to accept that the girls could just go out in public spaces for no reasons. There has to be conditional mobility for girls to be out. So norms related to mobility and norms related to gender roles seem far too deeply entrenched in the realities of these young boys and young men, and there is a very slow shift in that. The other learning that we have drawn, the other insight that we have generated is that these boys and young men seem to negotiate these shifts in norms in their specific reality. So it's not a uniform shift. Most boys and young men, even if they tend to change their attitudes, they don't display that. So they find their unique and very contextual expressions of negotiating and uh, uh, aligning with the change process. For example, uh, brothers would not want to be seen supporting their sisters in public spaces when the sisters go and play a public sport. They would not be resisting it if they have changed in their attitude, but they would not want to be seen in public to be supporting their sisters, uh, because they continue to wrestle with the idea of girls and women's mobility, and they continue to find many different justifications for men and boys to control women's and girls mobility for the reasons of safety. And this shows up in the bystander interventions. We find that a lot of these boys and young men are not, even if they have agreed to these shifts in their attitudes and their beliefs in gender norms towards more equitable ones, they would not immediately readily be willing to intervene if they witness discrimination, or if they if they see that there is a harassment in the public spaces by their own peers. uh, they would make a judicious call. They will make a strategic call in terms of when they want to intervene and when they don't want to. And that has been hard part of the interventions, and that's something that we need to work hard as to how to begin uh, uh, make the boys realize that they have once they agree, they need to intervene and do something publicly to demonstrate their opposition to the inequitable and behavior and violence in public spaces. Next, please.
Ravi, I
So
don't
how,
want to rush you, but if we could ask you to wrap up quickly, we want a few
last
minutes
slide.
left for questions. Thank you.
Last. So what do we do? How we have addressed that? What we think is that the young boys should be engaged as an agent of change and not recipient of the programs. We have seen in these programs, young boys have begun to influence their own family members and the peers in a very negotiated manner. And a lot of these changes we see has been happening because the programs have reached out to them in their informal spaces and not through the formal interventions. So all these four programs, we see a very strong component of intervening within the informal groups and informal spaces of boys, where they deliberate, reflect, dialogue among themselves, and challenge this. We also find that very proactive family engagement and positive spin is what works. And our data, very recent data from the Parvartan, shows that the elevated level of aspirations on the part of mentors and their mothers was actually strong driver for bargaining the mobility of girls in the public spaces. So if the mothers and the mentors saw that um, there is an aspiration, then they begin to translate that into the programs. And then we found in all these programs that collective agencies has to precede the individual agency building and skill building on negotiation. So individuals need to be embedded within the supportive um, presence of supportive reference group, where they could find a very strategic and gradual negotiation to create the equitable spaces. So I'll just stop here, and I'll be happy to respond any questions.
Thanks so much, Ravi, and apologies for rushing in. We wanted to make sure we had time for questions and answers. And I'll just pop myself back on screen here. So we've got about 10 minutes left, and we do have a few questions that have come in. I want to note, if you submit your questions on the chat box, we will record those. The ones that we don't get answered today because of limited time, we will try to follow up. So go ahead and type those in. I'll ask what we can. We'll answer what we can today. The answers will be posted on the Align platform. And Ben, actually, if you could pull up the last slide of Caroline's presentation, just so folks have that access to the website and the forum where they can go for more information, that would be great. So thanks to all of our presenters, and thanks to those of you who are now rapidly submitting questions. I'm going to ask the first question from Carrie Macquarie about evaluation. And Carrie notes that it's so important to measure other dimensions of gender equality and relationship dynamics beyond traditional measures like decision making. Has SASA made the evaluation instruments and questions available to the public? Has SASA done any validity testing, cognitive interviewing, et cetera, around these measures and questions? So Lori, if we could go to you to answer that one, and I'll collate a couple of the other questions.
Sure, thanks. Thanks, Carrie. Yeah, you're very, very right. And yes, the tools are available publicly, and we did a lot of validation because, you know, we did a baseline for in the SASA RCT, and then did a lot of work on those questions in the interim before the end line as well. And so we did cognitive interviews, we did a lot of observation and qualitative work. We looked at other scales and actually realized that some of the scales we couldn't really use that were sort of commonly used. They didn't really work in our areas, and so yes, they did. And I'm happy to follow up with you individually for more as well. I know we have really limited time, but I'm happy to share with you further.
Thanks, Lori. And while we've got you, there's another question from Sarah Jane Holcomb. How long did it take and how much did it cost to implement SASA in the communities in Uganda?
Sure. We implemented less than 3 years. It was supposed to be 3 years, but we had a lot of political unrest during that time. So it was about 2 years, 9 months that we were implementing. And we did a costing study. There is a paper on it. If you just look up on Google Scholar, SASA costing study, but it turned out to be about $1 per day per community member. And there's different measures. And again, we have a whole presentation that breaks it down in a little bit more of a popularized way, and I'm happy to send that to you so you can get in touch with me afterwards. There's different measures around the costing.
Thanks so much. There are a couple of other questions here around indicators and measures. And I think this is a topic that probably deserves its own webinar in terms of how you measure gender norm change, what the indicators are. But very quickly, if I can ask the presenters to address what you see as some of the data challenges in terms of measuring gender norm change. Real quick and easy question to answer. And what are some good quality, robust indicators to track change in gender norms? Caroline, do you want to start with that one?
Sure, I'll just offer a quick set of points. So tracking change in gender norms, I've really looked at from the sort of more global indicator perspective, where we've combined different types of indicators, such as attitudinal data with prevalence data and legal data, in order to triangulate the best of the information we've got. So following, how laws change, using the World Values Survey amongst others, and how attitudes change, because there are some global attitudinal surveys, and then the prevalence. You get a picture of how norms are actually changing over time. The place where I know much of this data is hosted is the Social and Gender Institutions Index, which is hosted by the OECD Gender People, and that's a global database which has both low, middle, and now high-income country data. So do visit that if you're interested on the global data side.
Thanks, Caroline. And another one for you, or anyone could answer, but I'll just, since we've got you there, this is from Jill Quinn, is there any good practice on how to address gender norms that are non-binary? How can we address the gender norms of the LGBTQI+ community in development?
Yeah, we think this is an extremely important question. Obviously one that in some countries is really difficult to address, and we have been talking with our partners about how we represent this on the Align platform and how we maybe work with some of our close partners to bring out some more sort of empirical work. And some of the feedback we've had, of course, is that it's extremely, in some contexts, unfortunately, extremely dangerous for people to work on some of these issues. So nevertheless, we feel, of course, that the Align platform should cover this. We have a commissioned piece of work, which is going to be an introduction, frequently asked questions to help people understand at least some of the language and some of the issues that are out there and emerging. And try and understand some of the approaches. So that is forthcoming. Please come back to the Align platform. There will be pieces of work going up from that community as we reach out to them. And as I said, probably in the next couple of months, we'll have the first piece up there as a sort of guide to understanding how this is being considered in development.
Great, thanks. And apologies that that the answers here are rushed, but again, to remind folks, we'll have more complete answers on the site in writing. For Ravi, what are some of the important considerations around engaging adolescents in ICRW's program strategies? And then how can adolescent SRHR programs, sexual and reproductive health and rights, be designed to address the generation gap in negotiating gender norms involving members of the support system so that you have sustained impact? So I take that to read, how can you design programs that address norms that adults have around adolescent sexuality, for example?
Yes, I think that is the major challenge in designing a program around sexual and reproductive health for adolescents. What needs to be done is really to bring an interface between the adolescents and the old elders, the family members, and that's what one of the learning that we have found is that the getting family on board and getting discourses and discussions embedded within the elders and adults is critical. Very often the programs on adolescents on sexual and reproductive health happen to happen implemented in silos. They just happen where the adults are seen as message givers or someone who comes with the idea that needs to be implemented by the adolescents. This does not work. You know, the adolescents, especially in that age group between 15 to 18, have so much enormous amount of information that they gather from many different sources, and they're processing that information. And there's no one way that one could be top down in helping them to process that information or help them to form the attitudes and change their thinking. So there is one in designing, one critical aspect that I would suggest is to find platforms where there is a dialogue, there is a interface between adults and the adolescents on difficult issues. I'll just take a few seconds. In many programs, we have seen that the adults, the mentors, they come from the program side, from the health department side. They deliver these speeches, they give the ideas, and then they go. There is very little interaction. I think none of these programs are designed to challenge those knowledge and the attitudinal foundations within which sexual and reproductive health programs have to be implemented. So yeah. I think we have to really push the boundary there.
Yeah, thank you, Ravi. And I wish we could discuss further. And actually, Ben, if we can get the polls up, we have, as I mentioned at the top of the call, 3 quick questions for you all to answer. And these are really designed to help the Align platform identify how they can best help those of you who are interested in gender norms moving forward. And I think part of what these questions that you've asked that we have and haven't been able to get to will do is help prioritize future webinars. But in the meantime, if you can get your cursors ready, you have a question up here. How often would you join a webinar to learn about gender norms, programming, and research, digging perhaps deeper into some of the questions that we just touched on today and some more. So if you could please take just a few seconds to click on these 3 choices, and apologies that it's just 3, and then go ahead and click on your selection, and we'll show the results in just a few seconds. Sorry, we've gone over. We'll try to wrap this up quickly. So Ben, can you go ahead and show the results? Great. Okay, thank you all. Next question, and we'll do this all in about 30 seconds, so please bear with us if you are able to. What resources on gender norms would you find most useful? Please select just one. Recognize there might be multiple. Just want to give the team a sense of what is most critical for you all. All right, let's go ahead and show the results. Okay, so tools, toolkits, followed by journal articles and policy briefs. And the last question. What theme do you focus most on? Violence against women and girls, education, health, SRHR, economic empowerment, or cross-cutting approaches? We know this doesn't cover everything, but select all that apply so you can pick more than one. Okay, let's show the results. Okay, great. Hopefully that helps the team get a sense of what this community is about and looking forward to. So I'll just very quickly, for those of you who are left, close out with a couple of summary points that we picked up today. Gender norms obviously are complex, but critical to understand if we're going to design effective programs and shift harmful behaviors. Norm change can take a long time. Some take longer than others, and it needs to be accompanied by other changes in society. What may work in some settings and with some populations may not necessarily work in others and with others. So it's important to know your target audience and be open to listening and learning and to shifting and changing along the way as you learn. We know we've got some good evidence, some of which was shared today, about how to shift social norms, but we need much more. So research, monitoring, evaluation are critical, as is the dissemination of findings. This includes, as Laurie talked about, learning from and sharing what doesn't work and what may actually do harm. And to that end, the hope is that you'll see the Align platform as the go-to resource for working on gender and social norms across a range of sectors and issue areas. And we encourage you to spread the word to your colleagues about Align, including to those who are producing evidence and who want to get that evidence out there and utilized. The platform can help you and your colleagues do that. So please go ahead and sign up to join the Align platform listserv. Go to the alignplatform.org/forum or follow the project on Twitter. And for now, thank you very much for joining us today, and thanks to all of our presenters for their great insights. Have a good rest of your day.